Hello, everyone. Thank you for attending our oral presentation of the project entitled Complicated Surgical Wounds, Prevalence, and Associated Factors in Public Hospitals in Manaus City in the Brazilian Amazon. My name is Carol Gonzalez, and I am representing a research team from the University of São Paulo's School of Nursing. The objective of our project but before, all the authors of this project declare no having any conflict of interest related to this project. And the objective of our project is to identify the prevalence of complicated surgical wounds in hospitalized adult patients and analyze the socio-demographic and clinical factors that are associated with this occurrence. These considering that complicated surgical wounds are preventable but are related to surgical outcomes, causing prolonged hospital stay, increased antibiotic use, increased risk of microbial resistance, increased health care associated costs, and pain and suffering. So an example of these kind of wounds are fistulization across through the surgical wounds and the dehiscence within other types of complications. So this project was an observational and cross-sectional study, an epidemiological one. Our population was composed by 20 people that were hospitalized in 7 kind of hospitals in Manaus. This is the main city of the Brazilian Amazon, as you can see in this map. And from this population, 775 people were volunteers. They accepted to be part of the study. And from this sample, we extracted the data from 251 people that were submitted to different surgeries. So as a result, we were able to calculate a prevalence of complicated surgical wounds of 6%. And the main characteristics of these individuals with the complications where the main age was 51 approximately. They were mainly males, 93%, with the skin color 9 years of education in average, mainly hospitalized in general clinical services, with diabetes mellitus almost 30% and 33% with arterial systemic hypertension. Regarding the body mass index, it was normal or overweight in 40% and mainly submitted to programmed surgery, 53%. When we looked deeper to analyze the associated factors, we found out that being male, meaning the masculine sex, and the presence of ecchymosis increased the risk of having a complicated surgical wound by 8 times or 8.4 times and 7.9 times. These with statistical significance results. So as a conclusion, we concluded that hospitalized people in the main urban center in these 7 type of public hospitals submitted to surgery had 6% of prevalence of complicated surgical wounds, with having the presence of ecchymosis or being male as risk factors or associated factors. And these results are very important for strategy developments for early detection and prevention within nursing and managers. As references, we have the thesis, the doctorate thesis from which this work was extracted, and also our publication in a preprint in Cielo preprint database. Thank you very much.